During appendectomy, if it is noticed that base of the appendix is inflamed, then further treatment is option A, no appendectomy, option B, no burying of stump, option C, hemicolectomy, option D, cecal resection. Okay, so answer for this question is no burying of the stump. Okay, so let us go for the discussion about the this question. Okay, appendectomy, there are some special circumstances. Okay, you have to you will come across while doing appendectomy or appendicectomy. Before going into these special circumstances, I just want to briefly tell you about that how the open appendicectomy can be done. Okay, it's very simple. You may, all of you already know this appendectomy. Okay, so consider this is the patient having the cecum is there, ileum is there, and then appendix is there. Okay, for example, this is ileum and cecum. Okay, so first one, so what you have to do, first you try to identify the appendix. Okay, the base of the appendix is in the constant position. Okay, base of the appendix, so it will be present at the level of the ileocecal junction. And number two, it can be identified intraoperatively by the convergence of three tinea coli. Okay, so at that level you will have the base of the appendix. This is number two. Okay, so first you try to identify the base of the appendix and followed by appendix completely, and then you try to identify the mesoappendix. So within the mesoappendix you got the appendicular artery. The first step in your surgery is to ligate the appendicular vessels and divide the mesoappendix. Okay, so you divide the mesoappendix completely. Okay, once you completely remove divide the mesoappendix, you will have the only the appendix without any blood supply. The next step is you have to do crushing of the appendix. Okay, this is not I'm going to tell some steps. Nowadays we are not practicing these steps. These are olden steps and it is given in the text also. So I'm going to tell that first you crush the base of the appendix. These are all theoretical. Nowadays we are not practicing, but still you should know. Crush at the level of the base of the appendix. That is the first one. Then followed by you put a ligature. You put a ligature over the crushed portion, ligature, and then divide the appendix. You divide the appendix and remove the appendix. This ligature, above the ligature you have to leave some stump. That ideal stump, it should be around 3 millimeter. Okay, 3 millimeter, because if you are leaving a more stump, then that may cause a condition called stump appendicitis. Okay, so this thing you have to follow. This is the usual steps followed in open appendicectomy, and finally followed by the suture called posting suture. So that has to be taken in the cecal wall. I will put another picture. Okay, so posting suture, you have to take it in the cecal wall close to the base of the appendix. Like this you have to take. Okay, inside that you got the appendix is there. Okay, so there are two steps you have to follow. One is called stump invagination. You try to push the stump inside the cecum, and after that you try to ligate these sutures. So you tighten the suture and ligate, the stump will be buried completely. One is called invagination of stump and another one is called burying of the stump. Okay, all these steps we are not following nowadays, so that also you should keep in your mind. Okay, that completes the open appendicectomy. This is the usual steps you will follow in the open appendicectomy. Okay, so next we are going to discuss about this appendicectomy in special circumstances. Okay, there are three conditions are there. Okay, consider this is the cecum, and this is ileum is there, and this one is the appendix is there. Okay, so first condition, that is the cecum. If the cecum is edematous, and as well as inflamed, okay, inflamed. So you should not follow the procedure. I told some procedures, you should not follow some steps. The number one is, that is bursting suture. You should not apply bursting suture, number one. And number two, stump invagination. These two things you should not do, because definitely already the cecal wall is edematous. If you are going to suture, definitely it will perforate, and that causes peritonitis and followed by sepsis. Okay, so that is the first scenario. Second one, if the base of the appendix is inflamed. Okay, so this is the base of the appendix. If it is inflamed completely, there also you should follow some steps, like you should not crush the stump. Number one is the should not crush the stump, but you can put a ligature. You can put a ligature and tie the appendix completely. Ligature you can apply, and the stump invagination also you can do it, but you should not crush the base of the appendix. This has to be followed in case of inflamed base of the appendix. Then if the base of the appendix is gangrenous, if the base of the appendix is gangrenous, what you have to do? You have to do this is considered. Okay, so this is the base of the appendix. It is gangrenous, that it will become black in color. Okay, so here you have to take 2 stitches in the cecal wall, 2 stitches in the cecal wall, 2 stitches in the cecal wall. You amputate these appendix, completely very close to the cecal wall. Once you take out the, I'll put another picture. This is cecum, and this is appendix, and this is ileum. Okay, so what you have to do, the appendix, base of the appendix is gangrenous, so this is a gangrenous. So what you have to do, you take a suture through the cecal wall. Okay, 2 stitches you have to take and completely amputate the appendix at the level very close to the cecal. That is called flush amputation. Then once you take out that, you try to close these sutures completely, tighten that sutures completely. Then followed by the second layer, okay, second layer you have to take the seromuscular suture, seromuscular bite, and here also you take a seromuscular suture, then try to tie it completely. So 2 layer closure you have to done in case of if the appendix is gangrenous. Okay, so that completes the appendicectomy in special circumstances.